Hi everyone, I am Dr. Daniel Careaga, and today I would like to talk about a diastasis of the abdominal wall. Now, what is a diastasis? A diastasis is a separation of the muscles of the abdominal wall. If you can imagine, your abdominal wall is kind of like a sandwich, and there is a top layer and a bottom layer, which would be the bread, and then the muscles are the meat, which is the middle. So the muscles are sandwiched between two layers of connective tissue. So the abdominal muscles are four pairs of muscles on either side of the midline, which in people that are in very good shape are called the six pack. And in ultra athletes, you can actually see the bottom two, and it's basically an eight pack. The thin layer of connective tissue that holds them together is meant to be able to expand when a woman is pregnant and then contract once the baby has been delivered. But in a percentage of the population, that contraction does not happen. The thin white line, which is usually about a quarter of an inch wide, can actually expand to where it's 4, 5, and sometimes even 6 inches wide. The result, if you look at the person on their profile, is a protuberant abdomen that in some cases makes it look like they're still pregnant. This is one of the biggest indications to do a tummy tuck because we need to reconstruct that weakening. Now, a lot of times there is a confusion between the diastasis and a hernia. The difference is this: a hernia is an actual hole in the abdominal wall. So imagine that sandwich that I talked about, there's a hole through most of the layers of it. The stuff on the inside, meaning your intestines or the fat that lives around them, can push out and you can actually feel it right underneath your skin. Versus the diastasis, which is just a weakening. So it's a weakening, so it allows the abdominal contents to gently bulge forward, but there is no hole. Generally, you have to use a mesh to repair a diastasis, with one exception. When I have a patient that has a very, very large diastasis, and I'm concerned that that connective tissue, that bread, is not going to be strong enough to hold the sutures, I will recommend reinforcing the entire abdominal wall with a mesh. So I do the initial repair. So I close the defect of the diastasis in 2 layers, like I do for all tummy tucks. And then on top of that, I'll place a mesh through the entire abdominal wall that gets sutured all around the periphery. This reinforces the repair. It takes tension off of the repair to minimize the chance that that diastasis is going to come back. The mesh is actually absorbable. It goes away over about 10 months. But the scar tissue that it's going to leave in its place is going to add strength to that layer to keep the patient flat and firm. So a diastasis is a very confusing term. A lot of patients, and actually a lot of doctors, have difficulty understanding the difference between a diastasis and a hernia. But now you know the diastasis is the weakening of the abdominal wall versus the hernia is the actual hole through the abdominal wall. One of the most common questions I get from my younger patients that need a tummy tuck, because due to the fact that they either lost a lot of weight or they had a child and were left with a lot of loose skin, a big muscle separation or diastasis, is can I have kids after? It's a complicated answer because the short answer is absolutely yes, you can have kids after a tummy tuck, but it's not the ideal. So the ideal tummy tuck patient has completed their childbearing, has completed their family, and now can reconstruct their abdominal wall, remove the extra skin, tighten the muscles, perform some liposuction. There are patients that have lost weight, that have had a child at an early age, and they're like, childhood is not in my plans for the next 5, 6, 7 years. And it's a lot to ask of them to go around and with that extra skin, with those changes that happen after pregnancy and after weight loss. So in those patients, you can absolutely do a tummy tuck safely. And a lot of patients say, well, I heard that you can't tie the muscles together if you're thinking of having more kids. And that is completely false. You can absolutely tie the muscles together. If the patient does become pregnant, the body will be able to very slowly over the course of the pregnancy relax and stretch to accommodate the growing uterus. There is no increase in risk to the mother. There is no increase in risk to the baby if you tie the muscles together in a tummy tuck and the mother does go on to have another pregnancy afterwards. Through the course of my 14 years in practice, I've had over 50 patients that I've done tummy tucks on go on to have a child after I did their tummy tuck. And I've actually only had to redo the entire tummy tuck on 3 of them. The vast majority of patients after a tummy tuck and have children afterwards, things will shrink back down because you have removed so much skin and you have tightened the muscles together. Sometimes you do have to come back and perform a little liposuction, do what is essentially like a mini tuck, just removing a little bit of extra skin above the pubis. but having to redo the tummy tuck is not that common.